Uganda medical researchers working directly with communities have been urged to adhere to standard operating procedures for emerging infections and risk management plans for conducting research amidst COVID-19. The Deputy Executive Secretary, Uganda National Council for Science and Technology, Dr. Patrick Ongol, says the guidelines are to steer how best research can be conducted in line with the Ministry of Health strategy on prevention and management of COVID-19 without compromising the rights and safety of both the research team and the participants.
This guideline is so essential is that you are trying to understand a disease and with very little reliable information also coming globally, but also at the same time you need to conduct research.
He said the investigators and research institutions have a role to ensure that research is carried out with the highest ethical standards to minimize harm. The research regulators said the method or medium used by the researchers to inform and consent the research participants must be for safety of both investigators and the participants, adding that personal protective equipment for COVID-19 should be made available to all members of the research team as tailored to the current Ministry of Health guidelines.
Our work as research ethics committees is to see and guide researchers on where to make appropriate changes, where change needs to be made in the view of the realities on the ground. One of the questions that has been coming in from investigators is that, are we chasing away poor researchers from doing work? And I want to say yes. If you don't have the means to do research, don't do it. From our perspective of protecting human subjects, if you can't protect the human subject, if you don't have money to ensure their welfare, then don't involve them in your enterprise.
The Director of Technology Innovation at the Ministry of Science and Technology, Dr. Maxwell Otieno Napa, emphasized government's commitment in empowering Uganda researchers with equipment to build sustainable capacity for the National Research Information Management System.
The system also enables management to research records and interacts with investigators more efficiently. UNCST, with the support of the project, has provided 5 tablets, 1 projector, one printer, a laptop, and an internet data subsidy to facilitate the research process for the 23 RECs in Uganda.
The COVID-19 pandemic is a crisis and a human tragedy, but it is also an opportunity to recognize and address the deeper shortcomings of the current health systems in the country. Sandra Kahunde, UBC.